Hello everyone, welcome back to my YouTube channel. This is Jane and this is the Overseas Nursing Bands. So how are you? Really, how are you? You're good? Very well then. Welcome back. Thank you for joining me again. And you know, this is Overseas Nursing Bands. We talk about everything, how a nurse that is trained outside of the UK and the European Union get to register to get their PIN to be able to practice in the UK. That's all what we're about. A drop of inspiration, a drop of fun, all good, isn't it? Yeah. So let's jump right into it today. What are we doing today? We're going to be doing planning. So we know in nursing and NMC OSCE, we have the API assessment, planning, implementation, and evaluation. So in the planning stage is where you do your nursing care plans for your whatever case you might have been given to. So it could be anything, it could be any situation. But before we start, I just want us to go through. They have a criteria, a marking criteria for this skill. There's a marking. I want us to go into a marking criteria, and then we can do one or two nursing care plans for two conditions or so. We'll see. I don't just want the video to be too long, so I'll see if I can only do one, then that's fine. If I can only do two, I've done some there already, and then we'll just go through it together. But what is the criteria, the marking criteria when you're doing your planning? That is your nursing care plan. So the NMC, your assessor, they have certain things. They have EMAT to say this is what you get, this is what you will get, this is what you would do, and for you to get past that skill, that station. And we know that planning is a silent station, is a writing station. It's you, the case that you're dealing with, and how you're going to plan for it. And you know, it's related to your assessment. So when you get, say you get someone with a fall, for example, and you've assessed them in the assessment stage, after the assessment, what next happens is after you've assessed, from your assessment, you now draw up a care plan to manage that situation while they are on admission in your ward or wherever. So that's what we're going to do. First and foremost, you must make sure your handwriting is clear. Yeah. I think I'm always surprised how I managed to pass examinations, because I just feel like, how did they manage to read my handwriting? Because sometimes even I can't read what I have written down. I know, but yeah, I just always wonder. But make sure your handwriting is legible, is clear, because if they can't read what you have written, how will they be able to mark it? So that is a very important aspect. And then you're supposed to identify two nursing, I have a pen with me, I was writing. You have to be able to identify two nursing diagnoses. So you brought a patient with pain, a patient that had a fall, was concussed, or any situation like that, and they've brought that patient into the ward, you're in the ward, and then you have to identify during your OSCE exams on that planning station, you have to identify two nursing diagnoses. You know, it's different from what the doctors have diagnosed. We all know that. So two nursing diagnoses and how to, or problems, and how to care for them. Identify what is your aim for this. Like, so you've identified the person is having a headache, or is having, okay, let's see, the patient is having a headache, or let's see what, well, whatever the situation, your case, usually most cases that we get, we know most of the common cases we get in OSCE, pre and post surgical cases, diabetes, ectopic pregnancy, which also falls in pre and post diagnostic cases. We also get probably chronic heart failure, or so any of those situations, leg ulcer, for example, we get any of those cases. So what is your aim for caring for that individual? Then you have to set appropriate evaluation date for both problems. So you identified the problem. If you know your they use now the EMATARID to deal with nursing care, nursing diagnosis. So what is your evaluation? What is your appropriate evaluation date for both problems? You have to set appropriate. It has to be, measurable. You can't say somebody that has pain, you say make sure the person stop having pain. It's not measurable. For how long? Is it after, is it after 1 week? Obviously, you know that to leave somebody in pain for 1 week is unreasonable. You make sure that within the next 30 minutes, even if the pain has not gone, but at least you've reduced it to a reasonable comfort for that individual. So pain can come in any nursing, in any case. If the person has had a fall, if the person has hematoma, if the person has had surgery, if the person has had ectopic pregnancy, if the person is having a wound, all of those things. So pain is very versatile. So with pain, it's good, you can use it in a lot of situations, and you apply it, and then, but you have to make sure it's measurable. You have to understand that you cannot leave someone in pain for such a long time, and this video is getting too long anyway. And then self-care, your interventions are current and related to best practice. And then your self-care opportunities, identify and relevant self-care opportunity, very important. What can they do to help themselves? So you've told the patient that, oh, you're going to refer them to, for example, to a pain clinic, and then did they have understanding? Did they accept to go to, and will the pain clinic help them? So that's what you have to look out for. So self-care opportunities, identify, and that are relevant. And then professional terminology used in your care plan, very important. Don't use confusing abbreviations. There are abbreviations that are well known, abbreviations that are standard. Don't the ones, sometimes when you're making your notes yourself, you make up abbreviations for yourself. No, those are not the ones. The ones that you need to use are the ones that are, but personally, I avoided using abbreviations during my, in situations like that. I don't want to be misunderstood, so I wrote it out in full. Whatever you're going to write, I would advise personally to write it out in full, just in case. You never can say. You don't want to lose mark on something so minor like that. And then ensure when you make an error, you don't swiggle. You just cross it out and just put your signature on top. So a single line, we all know that. And then make sure, very important, whatever you do, if your name, your signature and dates is not there, it's invalid. So you might have written the best nursing care plan, the best situation, the best disease condition and everything, but it's not signed, it's not dated, your name is not there. It's all a waste of time, isn't it? We're going to be using the EMATARID to do our nursing diagnosis, our nursing plan today, care plan. So we're going to use pain. Mr. James was in hospital post-surgery, and our nursing diagnosis is pain related to surgery. And our aim of care is to reduce his pain from the score of 5/10 to 2 or 3/10 using the Abe pain tool score. So that's what we're going to do. So using the EMATARID in your nursing, the care provided for nurses. E is for explain. So you will explain all aspects of nursing care to Mr. James. M, you monitor and observe, record as every 1 hour, every 30 minutes, and escalate where necessary. So E and M, tick 2 points. You got already. And the next one would be you assess Mr. A or maybe assist him, Mr. A, for using the pain. So you assess the pain, you assess his breathing pattern, you assess for pain, because we're dealing with pain. So you assess him for pain and record, obviously, escalate if necessary. And then we say teach, EMA, 3 points there. T for teach. So maybe teach him coping mechanisms, pain mechanisms, by repositioning him. So teach, T is for the teach there. So it could be teach him the best position to help relieve pain. Okay, if you sit like this, or if you lie this way to help relieve. Can teach him breathing exercises to help with pain as well. That is, so that's EMAT. Tick, 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 tick. You got 4 points there. And then you go to A, administer all prescribed pain medication. So if he has a pain that has been, so administer all pain medication and record. Tick. And then also A, refer. We can refer Mr. James to a pain clinic, because we're dealing with pain, so we refer to a pain clinic, or to an somebody, diversional therapy, all of those things that you can do to take his mind off his pain. And then I, inform Mr. James to use a call bell. So inform him how to use the call bell, or teach him how to use the call bell. All of those, you could do it. Then document. You have to document. So how many points have you there? You have to inform him on how to use the call bell. Easy, isn't it? Very, very, very easy and simple. So let's just do a recap. We said explain all aspects of care, obtain consent, monitor all aspects of care, monitor his pain, monitor using the pain tool or whatever you have, observe, record everything that you have monitored. Every hour, we're saying with pain. So monitor Mr. James's pain and record every hour and escalate as necessary. And then we went to A, assess his condition using the pain tool, the pain tool that we've been using. So we can say assess every 1 hour, depending on the severity of pain. Assess every 1 hour. And then we go to teach him on pain relief, deep breathing methods, positioning, anything could be. That's the teach. So you got a point there as well. And then you have the A, administer all pain medication and record. Okay. And then we have the I, inform him on how to inform Mr. James. Also inform him, please inform Mr. James on the use of call bell. Inform him on call bell if he wants to call the nurses, if he wants to, for example, if he's using a commode, or just inform him on how to use all of this. So inform Mr. James, not him. Inform Mr. James. Explain to Mr. James, monitor Mr. James, assess Mr. James, teach Mr. James, not him, refer to him in the first person. Okay, so then refer to pain management team, we are doing pain, so refer to pain management team and follow up where necessary. And also document all aspects of care. I hope that makes it easy for you. If you have any other care plan you want us to deal with together, you can comment at the bottom below. But with this and having this understanding helps make your OSCE planning easy. And please, I want to say it again, remember to sign, remember to date, remember to put your name down, otherwise it renders it invalid. And because you use different colors of pen for each station, so you can come and correct it. You'll be banned. Definitely you will fail, automatic fail in all aspect of your OSCE. So please remember to do that. If possible, maybe you could, that's what people advise to do, you could write your name, sign and date before you start, because in that rush, when you're in the zone writing, pulling out all that you have, you might forget. So once you get your planning sheet, you put your name, sign and date it. That makes it easy for you. Okay, so thank you. This will be the end. I didn't want this to be long, but it's long already. So but I will end here. I want you to let me know what you think, what else you want us to deal with. Do you want us to deal with the new OSCE skills, we talk about it and discuss it, let me know as well. But for the meantime, thank you. Please subscribe and put the notification button on, so that each time I post, you will get notified of what I've posted. And like, comment, and share to people that are needy. There are people that are doing their planning, getting ready for their OSCE. It helps them, it makes life easier for them, so share with them. All right, thank you very so much, and I'm wishing you all the very best in your OSCE, and very soon you will have your pin. All the best. Thank you so much. Bye, take care.